Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Meteor edition. This audio podcast is part of a Biome bullet. This audio podcast as part of a Lobostics Phantom, and this audio podcast as part of a Storm Lobostics production. So, in following the audio podcast in following the podcast, looking at ignorance and discrimination, which was a research poster presentation presented at the International Pediatric Nephrology Association in 2016, as sort of in following a sort of a second research poster presentation, which was presented at the which was also presented at the International Pediatric Nephrology Association in 2016, was collaborative works looking at issues in chronic kidney disease, or CKD terminology. And this collaboration was a collaboration between between the renal patient support group, the RPSG, and also in amongst a collaboration within an academic institution, with one academic institution, and also two sorry an, a collaboration between an academic institution, and also a collaboration between an NHS trust, a National Health Service, or NHS trust in the United Kingdom, and also an organization the where the collaborator had an affiliation with the London School of Health and Tropical Medicine, London School of Health and Tropical Medicine in the United Kingdom. And so a little bit of a background in regard to this research poster presentation works from 2016. So the aims around this works was to review and investigate some of the terminology and contentions surrounding chronic kidney disease classification and identification, the rationale for having a sixth CKD, or chronic kidney disease stage, is investigated as an alternative to CKD stages 3A and 3B. So historically or retrospectively, CKD stage of severity had a stage sort of three. Three has two subdivisions, subdivision 3A and subdivision 3B. In this research works, or this research poster presentation, a rationale for a sixth sense, sixth sense, sorry, made a mistake there. A rationale for a sixth classification, classification, or stage is put as an alternative to having subdivisions 3A and 3B. And in addition, some emphasis is placed on guidelines are referred to as the National Institute for Care Excellence, or NICE guidelines, nice guidelines throughout this research poster presentation. So chronic kidney disease, a bit of background. Chronic kidney disease is a long-standing condition in which amongst evidence has been highlighted as reduced renal function, or kidney function, and where this is evident aligned to where individuals are unable to filter blood blood to achieve normal physiology through through normal voiding of urine, to rid of toxins and waste from blood. So with a growing sort of aging population, CKD, chronic kidney disease, has a major has a sort of major public health concern. Before going on further, to also inform that CKD is not restricted to those amongst the older population, or even in amongst the population of sort of middle in amongst the sort of middle-aged population. CKD and sort of CKD generally can affect all the amongst affect all those from a varying age groups, and amongst those in those in those amongst the young and pediatric population. So in this works, or when this research poster presentation was presented, there had been evidence that it can and has cost the United Kingdom, for example, 1.2 billion to prevent sort of symptomology referred to as acute kidney injury, AKI, which results in a higher risk of death than myocardial infarction, and other primary conditions. And so, owing to increase of prevalences of primary diseases, or primary conditions, there is a higher risk of developing CKD, and there are also other factors that have an impact on the disease, including socioeconomic status, age, gender, gender, and ethnicity. The epidemiology of CKD in the United Kingdom, at least, had been outlined in various guidelines and National Institute for Health and Care and Excellence, or NICE guidelines, for example, are the sort of main guidelines, and have been the sort of main guidelines. And there are guidelines from the UK renal registry, and the prevalence of CKD has increased, and there are several determinants that need to be challenged, particularly on risk factors relating to sort of primary conditions. One investigation, for example, had found that or informed that CKD is often undetectable and often asymptomatic, where there are no symptomologies. However, it is recognized with other pre-existing conditions, sort of conditions or primary conditions. And as CKD progresses, and although symptoms may go unnoticed, it can escalate to advanced CKD, and advanced CKD. Although the terminology, sort of before going on, although advanced CKD is not specific to a particular CKD stage, in the research poster presentation, it had been informed that advanced CKD advanced CKD or established renal failure, can be associated with CKD stage 4, CKD stage 4. So some in now looking at some, now as part of this poster presentation, looking at some issues in brief. So some investigators describe acute renal failure or ARF. As acute kidney injury or AKI, and acute and or chronic and acute and or chronic renal failure or as CR as A sorry as ARF and CRF, and the terminologies have been used interchangeably in sort of in some in investigations that focus mainly on acute renal failure patients or recipients with abnormal estimated glomerular filtration rate. Studies also, some investigations have record of recipients or healthcare service users with a reduced baseline renal function, baseline renal or kidney function, where normally this would be so abnormal or reduced baseline renal function or kidney function would be less than 45 mil per min per 1.73 meters squared, in line to as the basis of estimated glomerular filtration rate. As the estimated glomerular filtration rate, or EGFR. Some of the main cases that have required hemodialysis, for example, were also called or referred to as acute, and being, i.e., potentially within CKD, chronic kidney disease, stages 3 through 5. And were associated with higher rates of morbidity and mortality. However, ESRD or end-stage renal disease, ESRD or end-stage renal disease, or CKD stage 5, is at the sort of severe end of the disease spectrum or conditions of the condition, where healthcare service users require sort of a form of renal replacement therapy or kidney replacement therapy, for example, peritoneal dialysis or hemodialysis, until a transplant becomes available. That being said, transplantation is in amongst the literature is and has been informed as a form of renal replacement therapy as well. And the issue here, what have been highlighted as part of the research poster presentation, is that terminology can become confusing, and there can be sort of an overlap between CKD stage. The issue is not new, and then needs to be more systematic. There needs to be more of a systematic review addressing the issue to provide transparency and justification between CKD stages. So a little bit in regard to sort of the sort of aspects of CKD definitions and classifications. CKD sort of definitions and classifications. So it is important to appreciate that there are different definitions in the literature for what separates acute from chronic, in addition to what separates chronic disease and other chronic illnesses. In regard to CKD terminology, this can cause confusion in classification and also identification. And CKD is often, again, sort of silent silent and an increasing issue in different populations, causing immense human morbidity and mortality. An online sort of um, in previous works previous works and in previous times, an online calculator is and was made available to and for anyone amongst the population to check creatinine being to check creatinine being the main one of the main biomarkers to determine renal function, and estimated glomerular filtration rate, or EGFR, which can and is used to assess renal function to confirm diagnosis or diagnoses. And so, despite variations in terminologies, guidelines, and frameworks, renal despite variations in terminology, guidelines, and frameworks, there has been a sort of a sense of endorsement in and around classification with fixed renal impairment grading, thus being mild, moderate, or severe. And other some investigations or works has informed CKD by the prevalence of CKD stages 1 through 5, including the sort of the sort of this including stage CKD stage 3, where there are subdivisions CKD stage 3A and 3B, where 3A is categorized as estimated glomerular filtration rate of 54 to 59 54 to 59 ml per min per 1.73 meter squared, and CKD stage 3B as 30 to 44 ml per min per 1.73 meter squared. So another calculation that has been referred to as the MDRD, an abbreviation for modification of diet in renal disease, and it's where for example, that before going on, sort of listeners, to inform that the MDRD, a modification of diet and renal disease, is a sort of a calculation much like EGFR, estimated glomerular filtration rate. However, the MDRD sort of calculation is used and has been used in and by for example by physicians and clinicians who primarily focus focus on aspects of nutrition as part of and in line to looking at aspects of renal pathophysiology, and so MDRD is and has been the most one of the most extensively utilized equations, aligned and linked with estimated glomerular filtration rate, and on the base and sort of based on some additional variables, and where these additional variables can impart heighten sort of aspects of this discrimination, and there have been more works more sort of prospectively looking at where works on investigators have looked at varying sort of calculations or works in amongst the literature to sort of identify sort of better ways or better ways to see that certain populations certain populations in amongst general society are not discriminated against when in context of determining renal function and when determining renal function. So however, prevalence rises, sort of prevalence or incidences rise with rise with age, and is found to be more common by sort of almost by default in females than in males. And again, in a previous audio podcast, excuse me, in a previous audio podcast, it had been informed that that renal disease or different forms of renal disease are more probable, or where incidences of prevalences are higher in females than in males, owing to sort of the anatomical aspects, where, for example, the urinary tract in females is shorter than in males. So by default, in females, there can be high incidences and prevalences, owing to at default being the sort of where the urinary tract and the on an anatomical basis, the urinary tract is shorter in females than in males. So the epidemiological importance at the same time of ethnicity has not been completely articulated, although one review, at least at the time of this poster presentation, had looked and compared investigations between a set of those in amongst an ethnic minority group, and compared to the UK, United compared to compared the United Kingdom to a United States population, and compared to the United States population, and now going into sort of looking at the different stages, different CKD stages, and then going into looking at sort of acute kidney injury, looking at AKI, before highlighting within this, as part of this work, what had been postulated in context of a sixth stage, and looking at sort of terminologies between looking at terminologies, and where terminologies are linked to a sort of where terminologies are linked to a sort of aspects of awareness. So CKD stage 5, CKD stage 5, CKD stages 1 through 5. So CKD stage 1 has been informed as kidney or renal damage with normal with normal or raised glomerular filtration rate, where the glomerular filtration rate is more than 90 ml per min per 1.73 meter squared. Stage 2 is referred to as renal damage with normal or raised GFR, glomerular filtration rate, where the glomerular filtration rate is between 60 to 89 ml per min per 1.73 meter squared. And stage 3, stage 3 is being referred to as moderately impaired GFR, or glomerular filtration rate, where it's where amongst the literature it has the glomerular filtration rate is anything between 30 to 59 mil per min per 1.73 meter squared. But again, where in literature the stage 3 has been subdivided. Stage 4 is severely impaired glomerular filtration rate. A severely impaired glomerular filtration rate, where the glomerular filtration rate is 15 to 29 mil per min per 1.73 meter squared. And stage 5 is end stage renal failure or glomerular filtration rate, where the glomerular filtration rate is less than 15 mil per min per 1.73 meter squared. Now, before going on, again, just to inform again that looking at where CKD, or chronic kidney disease, is concerned, generally it can again affect all populations, all sort of ethnicities, all age groups, etc. So as part of this works a research poster presentation, there had been quite rightly and applicably focused on a link between sort of the adult population, and also linking in with the pediatrics and young people population as well. So looking at sort of acute kidney injury. Acute kidney injury. So over the past decade or so, there have been efforts to improve the identification and management of monitoring CKD. And whilst there are 5 stages of CKD, a review has had informed that AKI has four categories. 4 categories. 1, vascular, where vascular being a condition in which blood vessels are obstructed. 2, glomerular, being a historical type involving an immune element, normally associated with where the second category is more identifiable and associated with those with recipients and patients who are amongst those who have been being diagnosed in amongst nephrotic or having nephrotic syndrome nephrotic syndrome, and having sort of where there is as part of diagnosis proteinuria, where there's more than 3 grams per 24 hour, more than 3 grams per 24 hour, and there is edema. So there's pitting of the skin and where edema is evident, and where there is low levels of the main protein being albumin. So where there is evidence of hypoalbuminemia, so low levels of albumin, and 3 where is tubular, where there's tubular involving acute tubular necrosis, or ATN, with renal impairment, and then 4 interstitial, which is not associated with the previous 3 categories, associated with previous three categories. And so an example could be where there is a presence of uh, of uh, of sort of hematological, where there's evidence in around a hematological component, for example, where there's eosinophils, where eosinophils are evidence, and where there may be drug related, where there may be a sort of a drug a drug drug related, or drug association, and where the drug relate where there's a drug association, and where eosinophils are concerned, and there is and where there's evidence in aligned to in with acute renal failure, or ARF. At the same time, nocturia, nocturia anemia, long-standing abnormalities in around arterial blood pressure, and neuropathy being sorry it, where recipients or patients may have issues in around nerves linking to certain pathways within as part of physiology and pathophysiology, are all associated with or can be associated with different forms of CKD, or chronic kidney disease. And acute kidney injury at the same time is again sort of has been divided into four stages, which are dependent on creatinine, creatinine findings within 48 hours, and also urine output. So in the poster presentation, there is a sort of an overview of the different stages in regard to acute kidney injury, and around acute kidney injury, specific to the different stages of acute kidney injury, and the poster presentations are available through the Renal Patient Support Group, the RPSG. Now going on to now going into, as part of this audio podcast, looking at what is being postulated and what is being postulated. So the new classification for CKD stages, CKD stages, CKD stages has postulated in has been stages as postulated as postulated in some works, removes the subdivision, the sort of subdivision of CKD stages 3A and 3B, and CKD patients with CKD patients, healthcare service users with CKD stage 3B. 3B would require an earlier referral than those with 3A for specialist specialist aspects of renal care. So earlier detection would prolong the CKD stage, and therefore interventional aspects of referral would occur, would and should occur at earlier stage, slowing down CKD, slowing down or preventing slowing down, not preventing, because by this time, and where someone is diagnosed with CKD stage 3A or 3B, sort of historically, they would the healthcare service user or recipient would then be more at risk of going into CKD stage stage from 3 CKD stage 3 to CKD stage 5, and so the idea, however, is by early referral, early referral to slow down the CKD, or sort of or what to slow down what would be referred as sort of full-blown CKD progression. And so, furthermore, methodical procedures to calculate the risk involved for treatment and diagnostic delay in CKD have been investigated. Analytical data collated has looked at sort of coded and uncoded CKD patients and the associations to CKD stages 3 through 5, and the results on the analysis had determined sort of unconfirmed CKD labeled as CKD, and appropriately coded uncoded CKD and miscoded CKD. And so patients sort of labeled as miscoded CKD received sort of treatment at much earlier stage with higher risk of where there were higher risk of comorbidities. So now, as to what's being postulated, or what was being postulated as part of this works, was where in amongst sort of the definitions and classifications, if you like, in around CKD stages, chronic kidney disease stages, and again, just to iterate, that not to do with acute kidney injury, AKI, but to do with in around the sort of looking at and specifically around chronic kidney disease stages. So in this research poster presentation, what had been postulated was that there would be CKD stages 1 through 6, and in regard to the postulation around GFR, glomerular filtration rate, and the classification, to highlight now. So CKD stage 1 would be where the EGFR or GFR would be 90 mil per min per 1.73 meters squared, and the terminology aligned to public health and awareness would be where there should be community education and awareness. In around CKD stage 2, it would be estimated glomerular filtration rate or glomerular filtration rate in around 60 to 89 mil per min per 1.73 meters squared, and the public health and the awareness the public health aspect in regard to this would be where it would be pre-screening. It would be referred to as pre-screening and health check. And then in around CKD stage 3, and recall now where part of the postulation is to remove the subdivision of CKD stage 3 as the subdivisions around 3 CKD stage 3A and 3B. CKD stage 3, the EGFR GFR would be 30 to 59 mil per min per 1 point. Excuse me. Would be 30 to 59 mil per min per 1.73 meter squared. And in around the sort of public health and sort of the public health sort of terminology would be would be where stage 3 would be referred to as acute. It would be referred to as acute renal failure, acute kidney injury, and where there is where a sort of suspect or high risk patients or recipients would have albumin creatinine ratio or ACR or protein creatinine ratio PCR monitoring, and then stage 4 would be where the EGFR or GFR would be between 15 to 29 mil per min per 1.73 meter squared, and where the terminology would be as terminology in regard to public health. In regard to public health, would be advanced CKD, advanced CKD or ACKD with treatment plan and options, and then CKD stage 5. CKD stage 5 would be less than 15 mil per min per 1.73 per 1.73 meter squared, aligned to the GFR and EGFR, EGFR or GFR, so less than 15 mil per min per 1.73 meter squared, and the sort of the public health and sort of awareness sort of terminology would be chronic would be referred to as chronic renal failure, end stage chronic renal failure or CRF, end stage kidney disease, ESKD, end stage renal disease, ESRD, and where there be treatment plans and options. And then CKD stage 6. So just to iterate here, CKD stage 6, CKD stage 6 does not exist. It does not exist. But in this research poster presentation in this works, which was presented again in around 2016 at the International Paediatric Nephrology Association, it had been postulated that CKD stage 6 would be less, where the GFR and EGFR would be less than 10 mil per min per 1.73 meters squared, and where specifically there would be where patients or recipients would have, as part of their symptomology, would be anuric, and where anuric is terminology where there is so there's no micturation, there's no sensation of going no sensation of or feeling of wanting to void, and secondly, where anuric is where for example there is no emptying of the bladder, and in around the terminology in regard to the terminology around public health and awareness would be where CKD stage 6 would be where there would be sort of renal replacement therapy preparation and transplant options. However, between stages 4 and 5, 4 and 6, between stages 4 and 6, recipients or healthcare service users would have the options between being on a form of renal replacement therapy, or and or being on on a path on in line with in line with a specific and particular renal guidelines. B prep for palliative or end of life care if and where required. At CKD state to iterate CKD stage 5, CKD stage 5 and stage 6, CKD stage 5 and CKD stage 6, for example, generally from a nephrological specific perspective, CKD stage 5 and CKD stage 6 is and would be too late for patients or healthcare service users to be on a form of renal replacement therapy, because the GFR, the GFR or EGFR, the GFR or EGFR by those those who are specialists in amongst secondary care, for example, would find it would have difficulties where there would be difficulties to prep appropriate access for treatment, and so thus between 4 and 6, between 4 and 6 is CKD stages 4 and 6 is and would be the applicable time for patients or recipients to be on a form of renal replacement therapy, including palliative or end of life care, end of life sort of pathway according to particular guidelines. As part of this, as part of the postulated terminology, CKD stage 6, CKD stage 3 again. CKD stage 3 should not be subdivided or divided because the estimated glomerular filtration rate or GFR between CKD stages 3A and 3B amongst amongst clinical practices and in amongst guidelines is already a narrow sort of subdivision. So where early in this research poster presentation, it had been informed that 3A is categorized as an EGFR of 54 to 59 mil per min per 1.73 meter squared, and CKD stage 3B is 30 to 44 mil per min per 1.73 meters squared, and so thus CKD stage 3 generally and has a EGFR or GFR between 30 and 59 mil per min per 1.73 meters squared without the 3A and 3B subdivision. And so now as part of this, just to sort of iterate, where CKD stage 6 has been postulated as a less than 10 mil per min per 1.73 meters squared, there is anuric, the symptomology of anuria, or where a recipient would be anuric. So there's no sensation of voiding or no sort of micturation or the sensation of voiding or emptying the bladder. In stage 5, there would be the additional sort of symptomology where where recipients would be oliguric. So there would be there would be some there would be some voiding, but the voiding or emptying of the bladder is and would be not enough to rid of toxins from the blood. So hence between the postulated definitions and terminologies in around 5 or 6, the additional terminology of including oliguric or anuric would help would and should help clinicians to actually determine between CKD stage CKD determine better between CKD 5 and 6 with particular specific symptomology. Highlighting in regard to some aspects of specific discussion, and then some conclusions. So CKD stage 5 can also be referred to as end-stage renal disease, and sometimes even end-stage renal failure. And while this means that terminology associated with CKD stages can be interchangeable, it can also cause confusion when providing healthcare service users, patients, or recipients with advice and care. So and then another question as part of this, another question is what defines CKD? What defines advanced CKD? So what this means, listeners, or what this means, listeners, is that there are many times, or there have been times where, for example, healthcare service users or healthcare recipients, for example, would go to their sort of appointments, for example, and also where clinicians and physicians would use the terminology advanced where for example healthcare service user would have advanced CKD, but then one of the questions is what defines advanced CKD? So again, one of the additional questions is should advanced CKD be excuse me, should advanced CKD be referred to as CKD stage 4? CKD stage 4, and there is a requirement. A requirement to screen patients or recipients who are at risk earlier to minimize further complications. CKD stage 3 is subdivided into CKD stage 3A and 3B, but number one, the estimated glomerular filtration rate ranges are quite narrow between the two. So so the question again is, one of the additional questions, is there a good reason for the division? Is there a good reason for the division? And amongst the literature, there has not been excuse me, there has not been any particular and specific specific justifications in around the subdivisions. And question two is both subdivisions need to be accompanied by the appropriate terminology if the present classification and identification system continues, even if revised. So there is not always a consensus amongst healthcare professionals in the coding and relating terminology. For example, acute kidney injury, end-stage renal disease, and acute renal failure. And this is where there can be a misinterpretation and confusion with regard to CKD stage and classification. and clear definitions, different definition terminologies that relate or regard to staging have been outlined in amongst the evidence. But healthcare service users, when I say healthcare service users, again to iterate, sort of those amongst the pediatric and young population and those amongst the sort of adult population, should know exactly what classification, CKD classification they have, and the appropriate applicable excuse me, appropriate and applicable and appropriate terminology, whereby where they are empowered to gain sort of to gain or access resources to support healthcare, to support aspects of healthcare. And so finally, listeners, just some conclusions. So guidelines on the management of CKD indicate that healthcare service users, patients should have frequent investigations to monitor sort of risk utilizing EGFR, estimated glomerular filtration rate, and ACR if and where applicable. Another amendment to the guidelines in some regards is not testing or screening people with EGFR, estimated glomerular filtration rate, or in around creatinine in around where it is in regard to CKD stage 3A, so between 45 to 59 ml per min per 1.73 meters squared. And however, if recipients are not tested, not screened the earlier stages, the earlier CKD stages, then around the earlier stages around CKD, then diagnosis can be delayed, An opportunity for early intervention is to sort of slow progression, to slow progression of a sort of CKD, to slow progression around full blown CKD, is and would be sort of missed, where there be where there would be sort of missed opportunities. And so patients or CKD patients or recipients in CKD stages 3A and 3B should be required in around having six monthly checks of in around EGFR. However, this split classification can again result in confusion, and it is suggested, and again in amongst this research, both the presentation, it is suggested that a further CKD stage 6 be included, and that the CKD stages 3A and 3B be replaced by a single CKD stage 3, because the EGFR sort of around the subdivision is a narrow CKD subdivision, and there should also be appropriate sort of terminologies affiliated with sort of with aspects of public health and awareness, and this should prompt opportunities and collaborations. So in sort of conclusions, the research poster presentation in this works sought to highlight put CKD guidelines into context in terms of disease onset and progression in around end-stage renal disease, acute kidney failure or end-stage kidney disease, chronic renal failure, and renal replacement therapy as being there is since there has been little or no consensus on how these terminologies, with exception of course around renal replacement therapy, which in amongst some guidelines is now is and has been referred to kidney replacement therapy, or KRT, and so at the same time and at the same time as finally scientists, healthcare scientists or scientists and renal teams or nephrology teams who have knowledge of clinical parameters and specialist understanding should also be involved in perspective of discussions as more public health awareness is a required in around this critical focus. That draws this audio podcast to a close, and this has been an audio podcast as part of a Meteor edition, an audio podcast as part of a Biome bullet, and an audio podcast as part of a Lobostics Phantom, and this audio podcast as part of a Storm Lobostics production.